This unit will discuss the Enterobacteriaceae, which are gram-negative bacilli, and these organisms will grow on MacConkey agar. There are other non-Enterobacteriaceae that will be covered in a separate lecture. Enterobacteriaceae are often referred to as the enteric bacteria. So these organisms are the normal flora of the GI tract, and they can be found throughout nature. Oftentimes the patient is infected as a result of their normal flora within their own microbiota. And often it is acquired through ingestion, through contaminated food, or through a water source. The exception to this would be Yersinia pestis, which is transmitted through a flea bite. The most clinically relevant organisms can be divided into two different types of groups. You have the opportunistic pathogens and the intestinal pathogens. With your opportunistic pathogens, these again are your normal flora, and they generally do not initiate any sort of disease in someone who's healthy, although if it's someone who is immunocompromised in any way, then the organism can start to grow and cause an infection within that patient. With your intestinal pathogens, these are not usually normal microbiota, and so with these pathogens, they do have a greater virulence factor than most of your opportunistic enteric pathogens, so it allows them to enter the host within a different way to cause the infection. Enteric bacteria may produce an extended spectrum beta-lactamase that will hydrolyze penicillins and the cephalosporins. Many of these organisms also possess antigens that can be used to identify the different serological groups. And so these antigens are divided out into the O antigen, K antigen, and the H antigen. And so each of these has a different mode of virulence as far as to prevent the host from attacking these organisms and destroying them and removing them from the body. And here you can see where these organisms are divided out into intestinal pathogens and extra-intestinal pathogens. So with your intestinal pathogens, you may already know of these, you may have heard of them before. So you have the Salmonella, Shigella, Yersinia, and E. coli. Now E. coli can also be an extra-intestinal pathogen, so it just depends on the particular species and strain of that particular E. coli as to what type of infection that it will cause. All of your Enterobacteriaceae are gram-negative bacilli, and so some people will actually refer to these as gram-negative rods as well. They can grow in the presence or without the presence of oxygen. They all ferment glucose, and they do grow on MacConkey agar as well as blood agar. Their appearance on blood agar is usually a medium to large gray colony. Then you have the genus Klebsiella and Enterobacter that can also have a mucoid look to it. These organisms are all oxidase negative with the exception of Plesiomonas. They are able to reduce nitrates to nitrites. There are a few exceptions to some of these organisms, but for overall general view, most of these organisms are able to reduce the nitrates to nitrites, and this is why screening a urine for urinalysis is very important as an early indicator to a particular infection with an organism with the Enterobacteriaceae, because when you do a urine dip, there is a pad on that urine dip strip that will demonstrate whether that urine has nitrites in it, which is an indication that there's a bacteria that's present that is able to reduce those nitrates to nitrites. These organisms are catalase positive with the exception of one of the Shigella species, and most of these organisms are motile with a little bit of a flagella on it. So you can see an image here off to the right where it depicts those flagella coming off that organism. So typically when you're culturing these organisms, you're using routine media if you're suspecting some sort of GI issue or food poisoning, then there would be additional media that would be added for stool cultures if it's performed on a stool culture. However, if it's just a routine culture or something like a urine, then it would include blood agar as well as McConkey agar. And what you're looking for, as opposed to what we learned about with our gram-positive organisms, that your gram-positive will grow on blood only, whereas your gram-negative rods, bacilli, most will grow on your blood agar as well as your McConkey agar with normal incubation, a normal incubation atmosphere with ambient air. And so what you're looking for is organisms that you're looking for pure culture. So one organism, if it is a mixed culture, then you would pick the individual colonies to work up away from something that's in a group. And then with your McConkey agar, you're looking for growth on your McConkey. And so here you can see where this organism did grow on both. And then from there, you're also looking at its ability to ferment the lactose that's within that McConkey agar. So you're looking for either the clear, colorless type colonies, or you're looking for that magenta color. And so once we determine if it's a lactose fermenter or a non-lactose fermenter, then we can start to divide these organisms out for identification. So we know that yes, it did grow on McConkey, so it is a gram-negative. And then we're looking for this magenta color. So here you can see two organisms that both demonstrate that magenta color. And one is a little bit of a deeper color than the other, but they're both considered lactose fermenters. And then here to the right, you have your non-lactose fermenter. You do not see that deep magenta color. So here is a flowchart that I have worked up for you. And so again, what we're looking for is growth on McConkey. So once we decide that we have growth on McConkey, then we know that we're dealing with a gram-negative rod or gram-negative bacilli. And so once we determine that that's what we're working with, and we're looking to see, does it ferment lactose? And so if it ferments lactose, then we get that magenta color, and that's considered positive. And then if it does not ferment lactose, then you would get that organism would just stay clear on that McConkey agar. And so what we do from there is once we determine lactose fermenter or non-lactose fermenter, then we have a series of tests that we can perform. Depending on the laboratory and their protocol will depend on how they work these up. Most labs do have automation techniques now that they will use for these organisms. However, you do have some smaller labs, physician's office labs, that do still do a lot of these spot tests. And if we were doing any sort of workup in a student lab, this is the similar pattern that we would work through. So first we're going to look at our lactose fermenters, and we'll work through this flowchart. So once we've determined if the organism is a gram-negative lactose fermenter or non-lactose fermenter, then we can start to narrow down the particular organisms and what they are. Now there are many other organisms outside of this list. We're just going over the organisms that will be encountered most often in the clinical setting. So once we've looked at our McConkey agar and determined that we are dealing with a gram-negative bacilli that is a lactose fermenter, then we're going to confirm that with an oxidase test. And so these organisms should all be oxidase negative. There are a few non-Enterobacteriaceae that will ferment the lactose on the McConkey agar, and so we're just going to rule out that this organism is or is not an Enterobacteriaceae. So if it is oxidase positive, then we can say it's a non-Enterobacteriaceae, and those are worked up a different way, and we'll look at that on another chart. With our oxidase negative, we would then do an indole test. So once we do our indole test, we determine if it's positive or negative, and then that helps to narrow down these organisms based on that indole reaction. And so once we determine it's indole positive, we know that we're looking at an E. coli or a citrobacter, and so then we can do some other tests to differentiate them, for example, a citrate. With our indole negative organisms, we would look at our colony morphology for the Serratia, which would demonstrate a bright red color. And then we could look at motility for the Enterobacter and Klebsiella. And remember, both of these are very mucoid looking organisms, so they may appear the same growing on the agar, so they would need to be further worked up to differentiate them. Serratia has been associated with infections from medical devices like urinary catheters or IV fluids, and they've also been associated with UTI and pneumonia. These organisms are slow lactose fermenters, and they may demonstrate a red type color. Sometimes when you're looking at various flow charts, these organisms will be placed in the non-lactose fermenter flow chart, but just keep in mind that they are slow lactose fermenters, and so what will happen is they will actually start to demonstrate this red color on the agar, which is very characteristic of this organism. If these organisms were plated on HE or XLD agar, they would be colorless, or on the XLD, they may also have a yellow tint to them. These organisms are motile, and they are DNase positive, OMPG positive, and if you were to do the decarboxylase test, they would be positive for lysine and ornithine. They are MR negative and VP positive. Enterobacter infections are the same as Serratia. These organisms are lactose fermenters, and they can demonstrate a mucoid type colony, and this is because these organisms do have a capsule, so it gives them that mucoid look. They're yellow on HE and XLD agar. The indole test for this would be negative. They are motile organisms, MR negative and VP positive. And I also want to point out that these organisms, any organism, when you do the MR-VP test, that they cannot be positive for both, so they have to be positive for one or the other. Here's an example of a spot indole test, and you can see the pinkish color is negative. You can see a little hint of that blue here, and this would be considered positive. But this particular organism is indole negative. Klebsiella pneumoniae. These organisms are found within the nasopharynx and within the GI tract. They do cause pneumonia, septicemia, UTIs, liver abscesses, and all strands of Klebsiella are resistant to ampicillin. These organisms are lactose fermenters, and they do have that mucoid colony appearance, and this is again due to that capsule. So you can see that very mucoid look in this image with the McConkey. You can see it a little bit with the blood agar, but it's not as apparent as it is with this McConkey agar, where you can see where it's just kind of that magenta color blended in with what looks like mucus. These organisms, if they were plated on HE or XLD agar, they would be yellow. And the indole test for this particular genus can be variable, which means negative or positive, and that would just depend on the particular species. So if someone was trying to narrow it down whether or not it's Klebsiella pneumoniae, then they would do the indole test as a quick indicator to determine that it is Klebsiella pneumoniae that they're dealing with. These organisms are citrate and urease positive, and they do decarboxylate the lysine. They are VP positive and non-motile. Escherichia coli, more commonly known as E. coli, is a lactose fermenter. There are some strands that are late lactose fermenters. When cultured on HE or XLD agar, these organisms will give a yellow color. If a triple sugar iron agar was set up, then this organism would produce a alkaline acids result. So your top part would give an alkaline result. So this is the slant, is the first part. And then the butt of the tube is the acid part. So you're talking about when you do the Ka, alkaline is the top part, the slant, and acid is the butt. These are with or without gas. So some of these organisms may produce gas, which means you will get a break in the agar from where it will produce gas and no H2S production. These organisms are indole positive, citrate and urease negative, MR positive, and you do have modal and non-modal strands with this organism. So again, these organisms produce an extraintestinal as well as an intestinal type of infection. With your extraintestinal pathogens, you are looking at something like a uropathogenic type of infection, which is a common cause of urinary tract infections. And just because of the anatomy, you do see E. coli a lot with urinary tract infections, and the fact that E. coli is part of your normal GI flora. Meningitis sepsis can be a cause for neonatal meningitis, and it is positive for the K1 antigen. With your intestinal type infections with E. coli, there are 5 major categories, and these are based on different virulence factors, clinical manifestations, the epidemiology, and the OH serotypes of these particular organisms. Here are the 5 different types of infections caused by E. coli, the intestinal type infections. Enterohemorrhagic E. coli we'll cover in a little bit more detail in the next slide. Enterotoxinogenic E. coli. The strands like this produce either a heat labile or heat stabile, a type of an enterotoxin. They can produce both. This infection is usually found in underdeveloped countries, and it presents with a watery diarrhea in infants or travelers within this territory. It's not an inflammatory type infection, and it does not present with any sort of fever. With your enteropathogenic E. coli, it does not produce any sort of exotoxin, but it can cause prolonged non-bloody diarrhea in children. And so with this organism, there can be some inflammation, but there is no fever in this organism as well. With your enteroinvasive E. coli, this particular organism or strand will actually invade the cells within the colon and cause a watery to bloody diarrhea. And with this organism, it can cause necrosis and ulceration, inflammation, and you can oftentimes not only find blood and mucus within the urine, but you can find the white blood cells or neutrophils as well. And this infection does present with a fever. Enteroaggravative E. coli. This particular strand does not produce stool that contains any sort of blood or white blood cells. And so with this organism, it causes persistent diarrhea in young children. There's no sort of inflammation or fever associated with this particular type of infection. EHIC or enterohemorrhagic E. coli, also known as E. coli 0157H7. An infection with this particular strand is a little bit more invasive. It does cause diarrhea, colitis, and can also lead to hemolytic uremic syndrome. With this, there's a buildup of toxins within the kidneys. And so the symptoms of this include hemolytic anemia with a low platelet count. And what it can do is eventually cause kidney failure and even death. And so there are 2 different types of serotypes, one which is non-modal. And so with this one, the patient will actually present with bloody diarrhea without the white blood cells being present. There's no fever. The patient can get this infection through water or foodborne type illness, and is often transmitted via ground beef. So to screen for this test, you would use a McConkey or to screen for this particular organism, you would use McConkey sorbitol, and this will differentiate from the EHIC, which would be sorbitol negative, and you can see an example of that here to the right, where you actually have a couple of different organisms growing here. So if you were to do the SMAC or the sorbitol McConkey agar, normal E. coli strands will actually ferment, so you'll see that pink color, whereas the EHIC will it will actually just produce no type of color to it, so you have clear colorless colonies. And so you can see down here at the bottom where those colonies don't have that bright red, pink, magenta color. So if you were to have a sorbitol negative E. coli, and so that would be a presumptive that you are dealing with an EHIC. And so from there, what you would do is you could use some of the commercial kits to do a serotype to further define whether or not that is what you're dealing with. Citrobacter species are normal within the intestinal tract, and they do cause UTIs, but it's also rarely can be seen with septicemia and meningitis, and it can be transmitted from person to person. So when we're looking to identify this particular organism, again, we're looking for a lactose fermenter. And so it can be a slow lactose fermenter, which means it can start to turn a pink, light pink color after it's been incubated for about 48 hours. Growth on HE agar would be colorless, XLD agar would be red, yellow, or colorless, and these organisms can produce H2S, so they could present with a black center on that HLD agar, but they do not all species do, so it would depend on the particular species of the Citrobacter. All of them are citrate negative, and so here you have this, citrate positive. So here you have the citrate test in which you get that really pretty bright blue color on that citrate agar. And so you do have a couple of different species, but again, some of them do produce that H2S and some of them do not. Your automated machines would further differentiate the different types of species. So now that we've reviewed our lactose fermenters, we're going to look at our non-lactose fermenters here next. And so once we determine that we have a non-lactose fermenter, then we will do that spot oxidase test. And then remember for our Enterobacteriaceae that our Plesiomonas is our only one that would be oxidase positive. So you can see it goes over here to our positive side. So we will cover Plesiomonas in the Enterobacteriaceae unit. However, the workup would actually go through the non-Enterobacteriaceae workup to get to the final outcome for Plesiomonas. So now that we know that we are dealing with a non-lactose fermenter that is oxidase negative, then we're going to further differentiate these organisms based on different characteristics. So first we will look at our indole. If we are indole positive, so we're a non-lactose fermenter that is oxidase negative, and now we'll do an indole positive, and we are determining that we have a Proteus type species. Proteus can also, depending on the species, can also sometimes be indole negative. But when it comes to that aspect, then we can usually determine that it is a Proteus based on the swarming motility that it has on the agar plate. Once we've determined indole negative, then we will look at other characteristics to differentiate these organisms. And so again, we're looking at our enteric type pathogens of Salmonella, Shigella, and Yersinia. And so with these, we're going to look at things like the TSI agar, their growth on HE, and their growth on XLD. So again, non-lactose fermenters, gram-negative bacilli that are oxidase negative. And again, your Plesiomonas will present as oxidase positive. and so that will kind of deviate on that flow chart. Our endom-negative organisms, our Proteus can be variable, so you could see it on either side of this chart. And then, of course, you got your pathogenic type organisms. Next, we'll discuss our Salmonella species. With these organisms, it's interesting that there are two different species. However, when we talk about the different infections that they cause, we actually talk about the serotypes of Salmonella enterica. And so with this organism, it can cause a variety of infections. And with these infections, they're usually associated with some sort of infection via poultry products. So this is where we associate with our food prep with chicken or turkey, and making sure that we clean up once we've prepared that on our work surfaces. And it's also been associated with a handling of different reptiles. And so with a foodborne illness, the organism is actually ingested via contaminated food, water, or milk. And with that, it does present as a gastrointestinal type of infection with diarrhea, low fever, nausea. And with that, symptoms can last about 1 to 3 days, and the patient can present with positive stool culture, but there's usually no sort of systemic type involvement. However, once the organism does present with a systemic type involvement, so you would be presenting with something like bacteremia, which would show with a high spike in fever, and you would also get positive blood cultures. You may have a few GI symptoms, but it's a little bit more invasive than just a gastroenteritis. If it develops on a little bit further and turns into an enteric type fever, this is also known as typhoid fever. And so with this is a little bit more serious of a disease. You can have fever, gastrointestinal involvement, but you also have positive blood cultures that usually present within the first week, as well as positive stool cultures within the second week. And with this organism, this is what's kind of been labeled with typhoid Mary. And so you can actually have carrier states with this organism where someone can be asymptomatic but actually carry the organism, and then they shed that bacteria without knowing it, and then they can contaminate food, which in turn can cause an effect to someone who ingests that food that has been contaminated. And so with this, what the patient would do would ingest the food. It would survive, the bacteria would actually survive passage through the gastric acids within the stomach, and then it would start to invade the mucosal lining of the small and large intestines, and then from there it would start to produce different toxins. And then with the invasion into the epithelial cells, will release cytokines to be released from those cells, and this will induce an inflammatory type of response. And so that's where the diarrhea will come in, and possibly ulcerations and destruction of that mucosal layer. And then it can disseminate from the intestines further out to a more systemic disease where you would get those positive blood cultures. So with Salmonella, our morphology would be a non-lactose fermenter or McConkey. So with these non-lactose fermenters, anytime you're looking at an agar plate and you see that you have, or a McConkey agar plate, and you see that you have a non-lactose fermenter, then that is your key right there, that you need to kind of pay attention to these organisms in a little bit more detail to make sure that you work them up to determine if it is one of these more serious pathogens. With the HE agar, this organism will present with a green tight colony, but what it will also do is it will have a black center to that colony, and so that black center would actually be the production of H2S. So you can see this organism on the HE plate, where it's kind of got that little blackness to that colony. So it's hard to tell that it's green because it is so dark, but that is the H2S production. With your XLD agar, the organisms will also produce that H2S, and so you get that red to brick red type of appearance on that agar plate with that little bit of a black center to it. These organisms are indole negative. If you were to do the triple sugar iron agar, then these organisms would produce with an alkaline slant and with an acid butt. So if you were looking in the tube, you would have alkaline here, acid here, and typically most of these medias that you use, if the organism was acid, then it would actually produce a yellow color in the bottom of the butt. It can have with or without gas, and it would also have an H2S production. So what you would actually see is the blackening of the agar. So it may appear something like this due to that H2S production. And sometimes, depending on the organism, it can go all the way through. It is modal, desorbitol positive, MR positive, and it will actually produce a positive reaction for all three of these decarboxylase type testing, and it is also citrate positive. With this organism, it has developed a multi-drug resistance, and so with that you can get the multi-drug resistant typhoid fever. And so once these organisms have become resistant to these different organisms, then it makes it a little bit harder to treat. So that's where your overuse or misuse of different antibiotic therapies can pose a problem, because if someone is a carrier to this organism, doesn't present a problem to them, the organism develops resistance to the different antibiotics, then once that organism is presented to someone else, then it can pose a problem for that person when this particular organism has a lot of resistance. Your Shigella organisms are transmitted human to human via the fecal-oral route, and so this would be via inoculating a food source with some sort of contaminant of Shigella. And so this is why another reason why it's very important to wash your hands after you go to the restroom. So these infections are gastrointestinal. It can present with symptoms in about 24 to 48 hours after ingesting of this microorganism. It can cause a watery diarrhea that's associated with vomiting, mild to moderate dehydration, and it also can present as dysentery, which is characterized by a small volume of blood and mucus within the stools, and it can cause abdominal pain. And so this happens due to the cytotoxin, the Shiga toxin. And so this causes inflammation and ulceration within the intestines and with those ulcerative lesions. And so what this does is this toxin destroys the epithelial cells, which can cause the production of the bloody and mucus-laden type stools. This organism is identified based on the morphology and different biochemical tests. It presents as a non-lactose fermenter on McConkey agar. On the HE agar, it stands out a little bit different because it does produce these green colonies, but they do not have the black center like the Salmonella did. Your XLD colonies are colorless, so they just kind of show up on the agar. They don't have any sort of special presentation to them. They are negative for indole, OMPG, urease, lysine, desorbitol. They are non-modal, and the TSI agar would present with a alkaline type slant and an acids type of butt. If I can get this going here. And they do not produce gas or H2S. There are a couple of different species of Yersinia. One that you may be familiar with or have heard of before is Yersinia pestis, and so this was the cause of bubonic plague, where the rodents, there was a problem with the rodents that had died in filthy conditions. The fleas fed on the rodents, which would bite the human, and then the human would get a flu-like illness that resulted of an infection within the lymph nodes. Yersinia intercalatea is a foodborne type illness that's associated with undercooked food products, and this can also resemble or present with something that's similar to appendicitis. When identifying these organisms, they do have a characteristic staining pattern, which kind of resembles a safety pin type look. And so what these organisms do is they have a bipolar type staining. It's kind of hard to see in this image, but you can kind of see one of the organisms here where it has a little bit of clearing in the center where it stains sort of on the ends of the organism, not necessarily in the center. You can kind of see a little bit here with these as well. These organisms are catalase positive, and they are motile at room temperature, so they would have to have an incubation at room temperature in order to see that motility. They are oxidase, indole, and urease negative. With colony morphology, they are non-lactose fermenters on McConkey. If they were plated on HE agar, they would have a salmon type color to them, or an orangish type color. With XLD agar, they are yellow to colorless. With your TSI agar slant, these organisms do present with an acid slant and an acid base or butt, so they would be yellow all the way through. No gas, no H2S. And one thing to point out, that one of these species, if it were inoculated on the CIN agar, that it would have a bullseye type appearance. So you can see here where these colonies kind of have like a darker center than they do edges. Your Proteus species are found within the gastrointestinal tract, so obviously they could be a problem as far as the anatomy and causing UTIs. These organisms are non-lactose fermenters on McConkey agar, and they do kind of have a smell to them. Some people says it smells like rotten eggs. I don't necessarily get that smell. With these organisms, though, they are very characteristic because they do have a swarming motility on the agar plate. So you can see where the colony kind of starts in the center and then it kind of works its way out. So you get this little weird fried egg type appearance around the edges. And here is a picture of one I took myself, where you can kind of see that this is actually in a mixed culture. So this organism here is a different organism. So all of this is something else, but then you kind of have the Proteus growing under it. But what you see is where the Proteus actually had a colony here, and then it has kind of started to swarm out. So you can see the little waves as it starts coming out away from that other organism, where you can see it's trying to get out here on its own. These organisms can be indole positive or negative depending on the particular species, and sometimes that indole test is done to differentiate the different species of the Proteus. It is MR positive, citrate positive, urease positive, and PAD positive. Plesiomonas is found in fresh water, and it's transmitted to the human host by ingestion of contaminated water or exposure to the skin or the mucosal surfaces that maybe have some sort of break in them. These infections can cause gastroenteritis. That's most commonly found in children. It's associated with an extraintestinal infection, infections that can include meningitis in neonatal patients, bacteremia, sepsis, and as well as septic shock. So with these organisms, they appear as shiny, opaque, smooth, non-hemolytic colonies on blood agar. On McConkey agar, they are non-lactose fermenters or lactose fermenters. and they do decarboxylate the lysine, ornithine, and arginine. So all three of these tests would be positive when you're performing that test. With your DNase, you would have a negative reaction, and your indole and oxidase would be positive.